I'm really excited to present to you Louise Myrland, Vice President of Programs at the Women's Foundation of Colorado, who, as you know, is here to discuss the economic impact of women in Colorado, on women in Colorado. As VP of Programs at the Foundation, Louise leads research, public policy, grant making, and statewide community engagement efforts to accelerate progress towards gender, racial, and economic equity for 2.8 million Colorado women and their families. In this role, she leads with trust and applies an intersectional approach to advocating for just, inclusive systems and investing in programs that improve economic opportunities for women of every background and destiny. Prior to joining the Women's Foundation in 2014, Louise helped build the Denver Scholarship Foundation from its founding and designed programs that propelled Denver public school graduates to pursue post-secondary education. She earned her Master's of Public Administration from the University of Colorado, Denver, and her Bachelor's of Science in Chemistry from the Ohio State University. Ladies, it's my pleasure to introduce Louise Myrland.
So much, Donna, and thank you all for the opportunity to be here with you this morning, and thank you so much for your interest in this topic. Before we get going, I want to say hi to my old friend Nancy. Back in my Denver Scholarship Foundation days, we had many opportunities to work closely together. It's so good to see you, my friend. And it is just a tremendous opportunity to be together with women, focusing on what's happening, where the needs are, and what we can come together to do to address the inequities that so many women are facing as a result of the pandemic. So I'll hope for the Zoom powers that be to cooperate with me again this time to share some slides that I've prepared to help with the presentation and discussion today. And I think it's working on it. How does that look on your end? Great. Fantastic. Thank you. I welcome the questions in chat, and we'll try to keep an eye on those as we go. But please don't hesitate to jump in too if there's anything you'd like me to address before I move on. This morning, I have, goodness, all kinds of information to share. I thought it might be helpful to briefly cover a bit more background on the Women's Foundation of Colorado. We are working toward a future Colorado where women and girls of every background and identity thrive. Our mission, the way that we are working to pursue that bold vision of a more equitable future, is that we are catalyzing community to advance and accelerate economic opportunities for Colorado women and their families. Our overarching goal is gender, racial, and economic equity. Racial equity cannot be achieved without gender equity. Gender equity cannot be achieved without economic equity. These are all tied together. They impact one another. And the way a woman walks through this world, unfortunately, still has so much to do on what opportunities will be available to her and what outcomes she and her loved ones experience. So we are working hard to address this goal in many, many ways, and sharing information, connecting with community, being in conversations like this is a really important part of it. So this morning, and to provide a bit of context before we jump into the COVID impacts, I want to lay the foundation, sharing some information you're probably familiar with, but it's great to have that shared foundational knowledge before we dive into what's changing of how things were before the pandemic began. And then we'll take a look at some of the many, many ways COVID-19 is impacting women and communities throughout our state. And we'll shift the conversation to what we can do to rebuild and reimagine the systems that we are all a part of so that we can get closer to that future we are working so hard to achieve. So this is a powerful, engaged group of women who know and have experience in many ways in all of our lives that systems weren't designed in this country to work for women. We've all experienced the impacts of forms of gender bias in employment and in educational systems, and we've all played a part in working to address them through our careers and our community engagement. And for that, I want to say thank you to each of you. Women were in a much more precarious financial position before the pandemic because these systems of inequity continue in our communities. Women of color especially face greater barriers to economic security, and did so for generations and generations before COVID-19 began because of intersecting systems of gender and racial oppression. And women of color have been directly experiencing the most pronounced impacts of the pandemic, specifically because of the inequities that existed before and were exacerbated by the pandemic. At a very high level, a snapshot of the impacts that trace over a woman's entire lifetime that demonstrate the gross inequities that are real and present in our state and getting worse because of the economic impacts of the pandemic. Before COVID, nearly 90% of Colorado single mothers of color raising young kids in this state had income inadequate to meet their most basic needs: housing, food, transportation to get to and from work, basic utilities, like keeping the lights and the heat on. This is a reflection of a no-frills budget without the daily coffee on which I depend so heavily, and without luxuries like internet access. Before the pandemic made everything worse, far too many single moms in Colorado, especially single mothers of color, were struggling to provide for their families, not for lack of hard work though, but because there were unfair, inadequate returns on their educational and employment efforts. And those kinds of inequities throughout a woman's lifetime follow her into retirement. 1 out of every 5 women of color aged 65 or older is living in poverty. We have so many opportunities and needs for interventions throughout an individual's and a family's life cycle, and some of the additional information I'll share today will underscore that in a number of ways. First, data that we are far too familiar with is that overall, comparing women's earnings and men's, men still earn much more than women, and the gender gap in Colorado currently sits at about 80%. So overall, women in Colorado earn 80% of what men in Colorado do. But when we look deeper, when we bring an intersectional lens to the earnings gap that women experience, we can see quite clearly here that the gaps are wider for women of color. Excuse me, I'm getting over a cold. We see that white women and Asian women are among the highest female earners. They're still earning far less when compared to their white male counterparts, but the earning disparities are greatest for Black women, who are paid just 63 cents compared to white men, Native American women who earn 56 cents on the dollar, and Latinas who earn just 54 cents compared to their white male counterparts. And these gaps remain when controlling for education, the fields in which folks are working, their experience in those fields. So there's definitely gender bias at play, and that is compounded by racial bias, and it leads to the greater inequities women of color experience. We see that there are lasting inequities related to women's educational attainment, which is, of course, one of the greatest indicators of what will be economic security in a person's lifetime. This figure shows that women tend to have higher educational attainment rates than their male counterparts. The difference among racial and ethnic groups is quite acute. White women are nearly 3 times as likely to hold a bachelor's degree than Latinas, and almost twice as likely to hold a bachelor's degree when compared to Black women. And we all know that women are continuing to enroll in higher education at higher rates than young men today. But women carry a much greater economic burden for their investment in their educational attainment and bear the vast majority of student loan debt. And when they're completing their degrees, women are still tracking into fields that pay lower wages and have greater gender pay disparities. And the inequities at the beginning of a woman's career continue and actually expand as they progress. Women hold the vast majority of our lowest paid positions here in Colorado, and men hold the majority of the leadership positions, both at the managerial level and in the top levels of authority in our employment across Colorado. Colorado is one of the most depressing states, really, when we're looking at leadership, with less than 8% of CEO positions in our state held by women. But there are a number of factors at play that were beginning to build momentum before the pandemic that we'll continue to work on to address the employment and earnings inequities, to continue to pave the way for more women to enter positions of leadership and to be paid fairly for the work that they're doing at every stage in their career. Another inequity that is on display in our systems is with women's business ownership and entrepreneurship. The vast majority of Colorado businesses are owned by men. And when looking at the businesses that are owned by women, the vast majority of those businesses are owned by white women in our state. And this has a great amount to do with the way that capital is invested in entrepreneurs. The vast majority of venture capital available nationally, following similar trends here in Colorado, is invested in male founders. When it comes to women founders, the access to venture capital is so greatly reduced that the tremendous ideas, the assets and talents of women, especially women of color, are continuing to go underinvested. And these are missed opportunities for their own success and for the businesses that are really tailored to meet the needs of women and families in our communities. In many ways, aren't getting the investment they need to provide those services and opportunities to strengthen our communities and the economy. Another reason that women were in a much more precarious financial situation before the pandemic began is because, with women concentrated in lower paying fields of employment, these are often positions that don't offer comprehensive benefits. In many cases, until the law required it recently, they didn't offer even access to 1 or 2 paid sick days, let alone health insurance. So women have a much greater likelihood of not having access to health insurance through their employers. And that's part of the reason that about 1 in 4 women in our state reported in 2017 that they delayed or completely went without care that they needed because of the cost barriers. And in addition to foregoing care, women, they have so many limits on access to reproductive health care, and without access to the care they need to determine whether and when women are going to become parents, that changes so many layers of their future economic opportunities for themselves and for their children as well. And my goodness, in Colorado, almost 10% of women overall have no access, even after the beginning of the implementation of the Affordable Care Act, have no access to either public or private health insurance. And that puts women at a much higher risk of a catastrophic medical situation, leading to medical debt that creates a hole so deep that it's nearly impossible for women to climb out of. So this is some of what was happening before the COVID-19 pandemic began to exacerbate these existing inequities. Without the opportunity to earn enough to cover their basic needs, women had far fewer opportunities to build up the kinds of savings that could cushion a sudden shock to their employment or earning potential. And we've seen this ripple in a number of ways. And that's why the impacts of the pandemic are often referred to as a she session. I was pretty sure I was going to fumble that. It's a tongue twister that gets me mixed up every single time. But the term she session was coined because this economic crisis has felt disproportionately on women in so many ways. In the early days of the pandemic, women experienced the largest number of the most sudden job losses. When we went into the stay-at-home orders here in Colorado, nationally, and across the world, it was the jobs held by women that were most vulnerable because women have tended to be concentrated in the lower wage, frontline service providing kinds of jobs that evaporated when we were all told to stay at home. And the employment impacts were felt most sharply by women of color. Hispanic women in the US experienced the steepest declines in employment in the early days of the pandemic. And because of existing systems of bias in our employment in so many fields, it was harder for women of color, especially Black women, to regain employment when our economy has had these fits and starts of beginning to hire folks back, try to reopen. And then again, the job losses have been most prominent for women of color as we've shuffled back and forth between, one step forward and two steps back as the pandemic has continued. And what we've seen is that the unemployment rate for older women too has been consistently growing throughout the pandemic, as a number of factors at play have either made it harder to get back into jobs when they've been prepared to return, or for older women experiencing a number of factors that may include some caregiving responsibilities for other members of their family. It has been harder and harder for older women to get back to the work that they wanted to do. In many ways, what shifts we're seeing in the labor market are being referred to as the Great Resignation. So in September 2020, when children first began to go back to school, in many cases that was in a hybrid or a fully online environment, or with many families pulling their children out of our public school systems and trying to homeschool to try to keep their kids safer from the high risks of being in an in-person setting. In September 2020, more than 865,000 women left the labor force to be able to meet the other demands on their time. And we saw a similar but not quite as pronounced trend in September 2021, when coinciding with the beginning of the school year, more than 300,000 women left the labor force as the school year began. A recent study published by the Federal Reserve found that indeed access to childcare was the most prominent culprit that drove college-educated women who had the potential to work remotely out of the workforce. And we'll take a closer look at some of the childcare impacts of the pandemic and how they ripple through the economy and our communities. I do want to share that yes, there are some signs of hope with the most recent job report from the Department of Labor and Employment. We saw last month that there were finally some signs of improvement for women's employment, with more than 250,000 women rejoining the labor force. So the prior month, more than 300,000 women left. Last month, many of those jobs were regained. It's important to note, though, that many of the jobs that women took last month were in hospitality. Well, hospitality is often regarded as one of the leading indicators for how the economy as a whole is going to recover. as we've seen people beginning to travel again, more jobs in hospitality became available. But women who are taking jobs in hospitality are typically taking employment roles with unpredictable schedules, lower wages, without access to benefits. And so while it is promising in some ways that women are returning to employment, uh, there are ongoing economic instability factors associated with low wage and poor compensation roles, like many of those that are available in the hospitality sector. And while, yes, we're glad to see women returning to employment, the unemployment rates for women, when we're looking across backgrounds and ethnicities, show that there are remaining inequities. Unemployment for women from September to October remained somewhat flat, with the overall rate at about 4.4%. For white women, the unemployment rate in the most recent month was just under 4%. But Black women are continuing to experience the highest rates of unemployment at nearly twice the rate of that for white women. Their unemployment rate is at 7% right now. And it remains higher for Latinas as well, with unemployment at 5.7%. Now, so much of the employment and earnings impacts that women are experiencing is tied to the way women carry the vast majority of caregiving responsibilities in our society. Over the entire course of the pandemic, maybe you have felt some of this too. I have a pretty involved partner, and he is a great dad, and he's the cook in our household. I am so grateful for him in so many ways. And even in our very strong partnership, there were still some imbalances in the caregiving that I took on. And this has been so pronounced for so many families. Women have taken on 31% more of the overall household and caregiving responsibilities. This is, half of a full-time job's worth of unpaid labor that women have added to what they were already carrying before the pandemic. Women are more than twice as likely as men to be responsible for the remote learning impacts. Last year, that was the majority of the school year in many communities. This year, it's at the drop of a hat. A district like Denver Public Schools might, in an effort to support families and teachers with some additional rest and self-care time, announce that there's going to be another day off of school before the Thanksgiving break, leaving families to scramble to ensure that their children are going to be safe. So often when kids are pulled out of their classrooms because of a need to quarantine, or when a school district has to change plans because they're trying to support their educators, or because there aren't enough healthy educators to be in the classroom and they can't find enough substitute teachers to take on that risk. When the children are not in school, women are picking up that slack in their family's environment. And this has only been exacerbated by the fact that nearly 10% of Colorado child care centers closed in the beginning of the pandemic and have not been able to reopen. There was a crunch making it hard for many families to attain the child care they needed even before the pandemic, because there are some gaps in our early care and education system. Throughout the pandemic, a third of Colorado families have reported that they could not access the care that they needed. And that has a major impact on women's opportunities to work to help support their families. And this has a huge impact on the childcare workforce in our state. Childcare and early education as an economic sector contribute roughly as much to our state's economy as the tourism, hospitality, and ski industries. So this is not an insignificant labor force to impact, with nearly a quarter of childcare workers furloughed at some point during the pandemic. This has had a tremendous impact on their own financial stability. And because everyone depends on someone who depends on childcare. Whether it is a manager waiting for their employees to come in so they can open the store for the day, or whether it is the parent who needs their childcare provider to be available so they can get to work. Everyone depends on someone who depends on childcare, and our childcare workforce has not been able to provide necessary care for so many families. And the earnings losses, the job losses borne by the members of the child care workforce have been more pronounced for women of color in our state as well, with 1/3 of Black early care and education providers reporting that they've had trouble paying their bills during the pandemic, compared with 16% of the white members of the child care workforce. And we all know that throughout the pandemic, even when childcare was not available, there were some workers who still had to get there. The folks who kept our grocery stores open, who made sure that healthcare is being provided to the folks most impacted by the health effects of COVID-19. Women have been the majority of Colorado's essential workforce, keeping us all going throughout. And more than 2/3 of Colorado's workforce in the highest risk roles, those with the most interaction with the public or in healthcare setting that put them at greater risk for contracting the virus. More than 2/3 of the Coloradans doing that high risk work in this pandemic are women. And let's see, there's a lot of information on this next chart. This was produced by CSU's Regional Economic Development Institute. They took a look early in the pandemic at the employment impacts of women and men, comparing white and Latino members of the workforce. And they found that the greatest risk of infection and the fewest opportunities to work from home, that Latina women or Hispanic women made up the vast majority of that workforce at the highest risk. And white women were more likely to work in those roles than their white men counterparts as well. Throughout this pandemic, women have been crunched and pulled in so many ways. And the women doing this essential work to keep Colorado going, to keep us safe, to keep us all fed, have been paid less than men in almost every sector for these essential high risk and frontline roles. Only in healthcare, where women make up such a large portion of the generally well-paid nursing workforce, did women have higher median hourly wages than men in the sector overall. The burden, the risk has been tremendous, and the reward for that work and those risks has been completely and wholly inadequate, and the gaps have been more pronounced throughout for women of color. And that is why the Women's Foundation of Colorado is so focused on centering women of color in the way we reimagine and rebuild our systems. We need to rebuild for equity. The employment protections that you all were talking about before we began my presentation this morning, the child labor laws, the industrial protections, what grew into OSHA. Women were at the lead of making sure that those changes were made to keep women safe at work and to keep children safe, and they had benefits for all of us. Every single person who works is protected and supported by the changes that were made with women at the lead and women at the center of those industrial revolution and changes. And women need to be the leading voice and the primary consideration when we're figuring out how we can rebuild our systems from here so that they work better for women and their families and will benefit everyone. Some of those recommendations I'd like to highlight before we jump into discussion are that there's absolutely a necessity to invest in caregiving across the spectrum, childcare providers, and those who are caring for older adults to meet health needs, and the women who are crunched between all of those needs for caregiving for their family all need more support. Public investments must be made in a market system that has failed. The economics of operating a childcare business simply do not work. The unaffordability of childcare so that workers who are paid low wages can continue to go to work and keep this economy building, it just does not work. We need public investments in the folks who are providing caregiving work that is essential for everyone in our community to be able to rely on when they need it. They are paid less than the typical warehouse worker right now. And we need investments in more caregiving facilities. There are so many gaps in our care systems that folks who need care are not able to access slots in those that are providing care for older adults and for our youngest Coloradans. And we need to address the affordability so that working families are able to access necessary and high quality care for their loved ones while they are going to work. And across sectors, we need to improve pay, benefits, and healthcare access for all workers, and ensure that we are doing so in a way that advances pay equity to close the gender and racial intersecting gaps in the way that people are paid for the labor they contribute to our economy. And right now, when so many families are struggling to meet basic needs, as housing costs are rising and the employment and earning impacts are continuing to hit Colorado families, especially those led by women, so hard, we need to make sure that basic needs supports are really fully invested in. And thankfully, the federal government is making some significant investments in state and local governments responses to the pandemic. We need to make sure that as those task forces at the state level and in each of our communities are determining how those funds will be distributed, how they will be invested for impact today that will also position our communities to be stronger into the future, that the needs of the women who are disproportionately impacted by the effects of the pandemic are the ones who are prioritized for those investments to meet current and future needs for women, their families, and all of our communities. And this requires that we are thinking about how, as a state, we really make paid family and medical leave really work. We're still a couple years out from the system that voters approved on the 2020 ballot, and the hard work is going in now to the establishment of that system. So I'd ask you all to stay in touch with the Women's Foundation of Colorado and our partners who are leading this work to know how you can lend your voice to the state's efforts to establish our new paid family and medical leave system so that we're ensuring that it really works for everyone who needs it. And there are a couple of other ways to stay connected with the Women's Foundation of Colorado and be part of these ongoing conversations about what is happening and what we can do about it together. Later this month, we're hosting a Chat for Change community conversation with gender economist Katika Roy, coming in to discuss why work isn't working for women, why we're seeing the trends of the Great Resignation, and what we as a community, what our economy needs to shift so that we can get women back to work in ways that really work for them, their employers, their families, and strengthen our Colorado economy. And a great way to stay in touch with the Women's Foundation to hear about the policy priorities that we'll be working on in the upcoming 2022 legislative session that begins in January, how to plug into advocacy, training opportunities and lobby days that we'll be organizing, and everything else the Women's Foundation is working on is with our Colorado Ambassadors Network. I like to say with WFCO, we can. And with you, we can make sure that we're doing everything possible to advance gender, racial, and economic equity. So I'd invite you to join us when we come together over the lunch hour on Friday, December 10th. And I'm going to take a sip of my coffee and pause there for questions. I'm really looking forward to the discussion with all of you. Thanks so much for your time today.
Thank you, Louise. That was enlightening. Depressing and enlightening, maybe, if I can say that both at the same time. But we as members of AAUW are all very familiar, with these inequities. Our as I shared before, our organizations are very similar. However, AAUW National is more, a lot of those numbers are similar. They're reporting on the national level. Appreciate that great insight into what's happening in Colorado. We do have a few questions. I believe, Peggy, that she answered your question, didn't she? Okay. Moving on to one of Mary's, do the numbers include all employment, for example, hourly independent contractors, etc., and also and those who left the labor force? Does that mean resignations, firing, etc. overall, because these are U.S. DOL numbers? What is the percentage of undercount? I don't know, Mary, did I get that right? Do you want to chime in and maybe just share your question?
Yeah, we hear these statistics and everybody knows that they're not complete because, there's a lot of people out there who do contract work, hourly work, whatever, sometimes are being paid without recording, et cetera, et cetera. So I'm wondering if you guys took into account what I consider major undercount of people who left the workforce. And also, I just wanted to know in the beginning, do you think that your statistics are really representative? Because I know sometimes when we hear the DOL numbers, we say, yeah, it's adjusted for undercount. So that's sort of my question about how reliable do you think your numbers are?
I really do appreciate the question, Mary, and will acknowledge that the numbers presented here are pulled from a number of sources, and a slide that follows, that discussion slide, includes the sources we tapped into for this. So we're relying on the numbers available through the Department of Labor and the analysis of trusted research partners like the National Women's Law Center to dig in and understand them as well. So we at the Women's Foundation have not done recalculations to control for some of those gaps in the widely available information. So some of the gaps in the data that you acknowledge are likely incorporated into and haven't been fully addressed in some of the numbers shared here. Thanks for lifting that up.
And I just wanted to follow up on, when you talk about leaving the workforce, that also is dependent upon what is above board recorded, right? That's basically unemployment numbers, right?
Yeah.
Okay.
So the employment and unemployment numbers are looking at those who are working or looking for work. The labor force participation numbers address those who are so left the labor force, yes, means a separation from a job, a firing, retirement, or have stopped looking for work if they were unemployed but are stepping away from the search for a while. Those folks who are separated from the workforce in all of those ways are factored in.
Thank you. Mary, I think you have the next question too. Do you want to go ahead and, well, I'm just going to have you guys ask them because you guys can ask better than I can read.
My question, I'm just going to look and see what the heck I said. Yeah, are you guys, I see all the statistics. We've heard this from a zillion different sources. And it's kind of like the COP26 conference, okay, we say all these things now, how are we going to get it done? Is there any recommendation by the Women's Foundation of who should spearhead the efforts, especially those that we've already voted for? So I'm just wondering, are you looking at a private sector, public sector combination? somebody's going to fall through the cracks regardless, but I'm wondering if there's a recommendation from the Women's Foundation as to the best way to achieve what they think is, I guess, just the best way to use those funds and move forward. That's my question.
That's a great question, Mary. And the Women's Foundation wholeheartedly believes that the individuals who are most impacted by the systems that produce these inequities should be the ones leading the way, the voices we should be listening to and following in all of the decision making to ensure that the systems we reshape work better for those who have been most marginalized by the systems of oppression that got us to this point. So what we mean by that is that women of color who are pushed to the margins on the basis of their intersectional identities. They are women, and so they are paid less than men. They are Black and brown women, they are paid less than their white women counterparts. These are inequities that exist in our system that are part of what we have all been socialized into. It is the women of color who know what they need to change, how these systems impact them in ways that limit their own economic opportunities, limit the choices they can make for their families. They know exactly what they need for economic opportunity and outcomes to improve in their own lives and for their communities. And they should be at the center of the decision making for how this work moves forward. An example of that is with the paid family and medical leave insurance system. So how are we implementing, especially these changes in our systems that have already been passed by voters? The Women's Foundation has been really proud to invest in and partner with a coalition of community serving organizations that is led by the women of color who comprise primarily the 9 to 5 National Association of Working Women, their Colorado chapter. The team at 9 to 5 is leading the way on the implementation efforts, coordinating with the Department of Labor and Employment in their new division of paid family and medical leave. They are taking the lead on reviewing the proposed rules and regulations and doing the legal analysis about how the proposed rules will impact the equitable outcomes we all want to see from this new system, and identifying gaps and opportunities to strengthen the language and the rules so that implementation will be more equitable. The Women's Foundation lends our support to those efforts financially to make sure that they have the team of organizers and legal experts to do that analytical work and engage community members in joining them to ensure that the Department of Labor and Employment hears their voices. We'll bring the name of the Women's Foundation and some of that that we have as a philanthropic institution in the state to sign on to show our support for the work that the women of color at 9 to 5 Colorado are leading in this work. So that's one example of the way that we think this should be happening and some of the ways that we're trying to follow up what we say we believe in and we're committed to with the actions the Women's Foundation takes and the way we're investing our resources as well to advance equity. I see, Nancy, your question about the leadership of 9 to 5. Yes, Drea Bogaflor is the Colorado State Director. She identifies as a woman of color, and she has been a tremendous leader in this work for the nearly decades-long fight to get Colorado to this point in the paid leave effort. And the women at 9 to 5 have been leaders in the fight for equal pay for equal work as well. And Women's Foundation and the team at the Colorado Women's Bar Association, we've been so pleased to partner with 9 to 5 in this work. And Nancy, I really appreciate the question about other organizations led by women of color. The Women's Foundation is partnering with, investing in, listening to, and following the lead of. Yes. In 2020, in addition to launching a relief fund to support organizations directly serving the needs of Colorado women and families. We were able to get nearly $800,000 out into communities across the state really quickly to meet those really pressing, urgent, basic needs. The Women's Foundation in 2020 also launched the Women and Girls of Color Fund, a field of interest fund that has generated a tremendous level of support specifically to invest directly and exclusively in organizations led by women of color, working to advance economic security and opportunity for Colorado women and girls of color. We brought together a group of 20 incredible women of color as leaders in the community across 4 generations. Non-binary folks who are part of this advisory council too are the ones making the selections of how the resources in the Women and Girls of Color funds will be invested. There are 21 rural serving organizations led by women of color that WSCO's Women and Girls of Color Fund invested in at the beginning of this year, and just in the end of September, another round of very significant investments were made in organizations all along the Front Range, led by women of color. And just last week, the Women's Foundation Board of Trustees approved grants that will be investing in organizations working on both the systems change level, state policy organizations, and direct service organizations working with women and their families and communities throughout the state. We haven't had the opportunity yet to notify all of the grant applicants about who was selected. So in the next time we're together, I'll be very, very excited to share more information about those organizations. I'm really pleased to say that the Women's Foundations and our community volunteers who work with us on the grant making selection prioritize organizations that are serving the needs of diverse women, those facing multiple and intersecting barriers to economic security, and organizations that have leadership teams, including staff and board, that reflect the community they serve. And we'll soon be able to share more about how those investments are being directed. I'm really, really pleased that together with our grant making committee of community members, we prioritized organizations led by women of color in the selection and actually chose to invest more deeply in their work, because so often mirroring the systems of inequity in the private sector, in the nonprofit and philanthropic sector, the organizations led by women of color and directly serving communities of color are often underinvested in. I want to say it's less than 2% of all philanthropic dollars in the US invested annually in organizations specifically serving the needs of women and girls. And the numbers are far smaller for those organizations led by women of color. The Women's Foundation's commitment to equity involves a redistribution of resources, specifically to prioritize investments in those who have been historically underinvested. And it's work we all need to be doing much more of. And I wish the Women's Foundation had many millions more resources than we do, but with every dollar we have, we are working to make direct investments in the individuals and families and communities who need us most, and prioritizing policy changes that will address inequities in our systems.
Thank you, Louise. That was great, and that actually answered one of my questions, because I was hoping that you would talk about the investments that you folks are making at the Women's Foundation of Colorado. It's pretty phenomenal. We do have, Jane has a question about the childcare availability issue, which is another question that I kind of had. So if you want to, Jane, could you go ahead and bring it out? Should you go ahead?
Louise, I'm wondering if there are any efforts in the Colorado legislature to address childcare availability and cost in the state.
Yes, I am so pleased that on many levels this work is underway and it needs to continue. So the November 2020 ballot, it seems like so long ago. You may remember that voters passed Prop EE, which funnels nicotine and tobacco taxes into a number of ways that the state will recover from COVID-19 and build more equitable systems, including with funding for what will eventually be a system that provides universal pre-kindergarten throughout Colorado. And part of implementing Prop EE and that investment in our early care and education system includes the legislature in the last session established a new Department of Early Childhood as a cabinet level position and department in the state's infrastructure. It takes the 20th constitutionally allowed place, the 20th and last constitutionally allowed place for a department of the state's infrastructure. Focused entirely on early childhood, including early care and education, child care, as well as many other aspects of health and wellness and overall well-being for our youngest Coloradans. And much of the work of what will be the new Department of Early Childhood will bring together and coordinate, focus, and align resources that have existed in a number of other ways in the state to help them maximize the impact of all of those state investments and resources. And we'll also add resources to build out a system that really works to provide universal pre-kindergarten. While those changes are being made, particular focus needs to be placed on how we also improve access to care and early learning opportunities for the very youngest children, those ages 0 to 3, that won't be included in the universal kindergarten changes that were made in recent years, the universal preschool expansion that is going to be made, that can put some pressure on the other care resources available. And so this Department of Early Childhood will help to ensure that all of those moving parts are being built in a way that they really work together and better serve families, and make sure that the child care provider system works for all of those who are part of it, including the child care workforce that is frankly vastly undercompensated for the tremendous value of the work they do, helping our youngest kids prepare for their long-term educational success. There is so much evidence that investments made in high quality early learning improve long-term economic outcomes for children who have those early learning experiences, their health and overall well-being, their community engagement as adults. I mean, just on just about every measure of what we hope for is improved with investments in high quality early education. And that requires high quality, highly trained expert early care and education providers. And I recently had a conversation with a preschool classroom teacher who had to be quarantined due to a COVID exposure earlier this year, and recently experienced the same cold that many of us are fighting, and had to take a few days outside of the classroom in the last week. But because they had already used all of their PTO, and this is an exceptional case because most early care and education teachers, their employers are not able to provide PTO for them as part of their compensation package. So this is an extraordinary case already. This individual I was speaking with recently had utilized all of their PTO to cover the required COVID quarantine to keep these youngest kiddos safe, and had to take unpaid time away because they were sick again and didn't want to expose the children in their care to the cold that knocked them out last week. And now this individual is trying to figure out how they are going to be able to pay rent. This is an individual who is working full-time, is highly educated, has a master's degree in early education, is developing the minds of these young kids, helping them develop the social and emotional skills they need to, get along with the kids in their classroom and ultimately be able to work effectively in teams in adulthood. And this is a person who works full-time and is making the right decision not to expose folks to a health risk, and is now likely not going to be able to make rent this month because of it. The folks who are in the early care and education workforce are in situations that are far too precarious. I know a number of other early childhood teachers who live together in a multiple roommate situation to share costs and to support one another. And these are not the kinds of choices that any of us would want to make, or that we would want to force anybody else into, but the realities of our ECE system and the lack of public investment over generations in this important work has put us in this situation. So there will be additional measures before the legislature in the upcoming session to prioritize some of Colorado's budget resources, including some of the federal funding being made available, but really looking for longer term solutions to improve the pay and compensation for the ECE workforce. And one of those levers for change is through a refundable tax credit that could be available to early childhood educators who are highly trained and who work in child care centers that allow families to tap into the state and local subsidies that make childcare more affordable for families in their community. And so you may, if you receive emails from the Women's Foundation of Colorado, or you join us for some of those upcoming community engagement activities, you may hear more about a bill to support an early childhood educator tax credit and advocacy opportunities to help get that prioritized in our state's budget for the years ahead. This is one of the many moving parts trying to strengthen our ECE system. And thankfully, the Women's Foundation has the opportunity to be a part of many of these conversations. And in this work too, we are seeking out, listening to, and following the lead of the folks who are most impacted by these systems. It's in conversations with early care providers. It's in conversations with center directors who are trying to figure out how they can do the best they can for their employees and their families. It's in asking for the insights of folks who interact with the sector and are part of the sector in many ways, that the Women's Foundation helps to develop policy solutions that will really work and address as many of these interconnected pieces as possible. So if you know anybody who should be added to the contact list for our early care and education workforce policy work group, we're always working to make that group more comprehensive and inclusive. And I'd be happy to connect the dots with anybody who would like to be part of that ongoing policy shaping work with us.
Wow, thank you. Thank you, Louise. That was just a wealth of information. And I think we all know and understand the early education, early childhood. It's incredibly important. And when you stop to think about, like you said, all of the moving parts, one thing affects the other, which affects the other, which affects the other. And I know the organization that I work for has an early intervention program for kiddos who are not quite where they should be at, and to help give them that extra lift that they need. It's so important. It's that we provide good education, good care, just to get these kids off on the right start. We just had, I'm thinking, Nancy, that I'm looking at your comments in the chat. Did we get to everything that you were looking for? Yes. Okay.
Yes,
great.
thank you.
Okay. I don't have anything else in the chat. Does anyone else have any other questions for Louise today? No. Okay, I don't see any. This has been very insightful and we really appreciate it. Folks, head on over to wfco.org, correct? for more information and to see what Women's Foundation is doing. I'm like I said, one of my questions was to hear about all of the many things that you folks are doing over there to help and to get us on track. So appreciate you sharing all of this today. And do you have any questions for us? Or please let us know if anything comes up where I'll try to share some of the programs that you have if folks want to get involved. But by all means, let me know if there's a way we can partner in any way.
Thank you so much, Donna. Please do let us know what you're working on and how we can be a resource to AAUW. And please do join us for the community events and learning opportunities we offer. There are registration links for so many of these events on our website. I'd encourage you to come and take a look and let us know what else you think we should be sharing with the community. If there's a part of our work that you might have heard some about today, but you're not seeing it on that upcoming calendar, let us know if there's a gap to be filled. And please do join our email list or our upcoming Advocating for Impact trainings. We'll soon be scheduling for the 2022 legislative session, and raise your voice. Oftentimes the folks who have benefited most from the systems that got us to this point also have the resources to invest in really good lobbyists and have a lot of bandwidth for that work. And so often the resistance to change for equity is loud and well funded. And we need to make sure that the voices for equitable change are just as loud. So please do join us in raising your voice in every way you can. You all have folks in your network. You are all in your own right influencers in this community. Think about the connections you have to the decision makers that are part of the governor's team, how you're connected to our state legislators, to the leadership in your local community. And if all of this isn't on their radar yet, please do share that it is important to you as a voter here in Colorado that the decisions they make our community stronger by putting women who are most impacted by existing inequities from the before times that have only been made worse in the last 20 months are at the center of their decision making. Because if those systems that we recreate together work well for women of color, they're going to work well for every member of our community. And so that should be the guiding star for all of our policymakers. And we need to make sure that they know that's important to their voters. So thank you for all of the ways you're already doing that. And I hope that I gave some fuel for those ongoing conversations today.